What's going on, you guys? This is Aaron from Departures Capital and welcome to the video. In this video, we're introducing an exciting new company to the channel, and that company is called VolitionRx. So VolitionRx is dedicated to revolutionizing the diagnosis and monitoring of life-altering diseases by advancing the science of epigenetics. So in this video, we're going to be taking a look at everything unique when it comes to this company, diving into their investor presentation, and also their most recent news, which is their quarterly earnings. So I hope you guys enjoyed this video. Always remember, guys, this is a sponsored video. For full disclosure details, always check the description down below for full disclosure details, along with thoroughly reading our disclaimer and always remembering that these videos are not financial advice. With that being said, guys, I bring you VolitionRx. So the first thing I wanted to take a quick look at was in fact their stock. So it is traded on the NASDAQ under ticker symbol VNRX. The company currently has a market cap of just over $60 million and a 52-week range of 58 cents all the way up to $2.74. So the stock is trading just off of its 52-week low. The stock looks to have found a bottom in this range, and hopefully we can see a nice recovery in the months and years to come. So this might be a great time to take a look at this company and put it on your watch list. So guys, the first thing I want to do is in fact dive into their website, and that is volition.com. So we can find here all the information about the company, including the investor presentation, which I do highly encourage you to download and read for yourself. But we're going to talk about the key points now, and there's an awesome quick video that basically summarizes what the company does. But let's talk about their mission. So, a brighter tomorrow. The company is dedicated to revolutionizing the diagnosis and monitoring of life-altering diseases by advancing the science of epigenetics. Our mission is to save lives and improve outcomes for millions of people and animals worldwide. So now let's talk about the company's quarterly earnings, because they just announced third quarter earnings. So first off, a quick note from their CEO. I'm pleased to report that in the first 9 months of 2023, revenue for the Nu.Q vet cancer test grew almost fivefold over the prior year period, reflecting sales of the reference kits through our global, regional, and local supply agreements. Additionally, total year-to-date revenue was $531,000, 185% increase compared to the comparable period of 2022. We believe that these results demonstrate steady growth, but not yet the ramp in revenues that we anticipate. We expect revenues to accelerate as we close out 2023 and into the early part of 2024, as several additional distributions come online with our Nu.Q vet test. A few more updates on the company. We continue to make considerable progress with our Nu.Q NETs pillar. Most recently, we completed the Q-Sub process with the US FDA, and we are happy to announce that they have agreed to the regulatory pathway of an additional 510(k) with an educated clinical comparator. We are grateful for the opportunity to participate in the Q-Sub process and appreciate the feedback we have received. The interactions were engaging and helpful, and we feel gave us clear regulatory path we need to follow for this potentially exciting opportunity. One more very important data point. In October, we unveiled what we believe to be an entirely new cancer detection method at ESMO 2023, the annual congression of the European Society for Medical Oncology, and hosted a webinar detailing this transformational method. Financial highlights when it comes to company cash and cash equivalents as of September 30th totaled $10.8 million compared with $10.9 million at the end of 2022. So the company's cash position remains almost the same as it was last year, down just $100,000. Subsequent to quarter end, a well-known institutional fund and regional government bodies of the Walloon region of Belgium approved additional funding to the company, aggregating approximately $6 million. We expect the funding transaction to close this month. Expect to receive a further $13 million in milestone payments from Heska Corporation in the coming months. So they seem to be fully funded for the foreseeable future. So those are some great updates on the company. Feel free to read this whole press release or tune into the webinar. The webinar is taking place at 8:30 a.m. US time, so most likely shortly after this video will be released. Now let's dive into the investor presentation and take a closer look at this company. This is our corporate deck as of November 2023, the most recently updated deck. So once again, their mission to save lives and improve the outcome for millions of people and animals worldwide. Some quick info. Who are we? Diagnostic company focused on epigenetic markers, epigenetics equal on top of or in addition to the genome. Human and veterinary use cases, screening and monitoring, disease progression and response to treatment, clinical and regulatory product development focus, sepsis. They believe that their total addressable markets are significant, more than 80 billion total addressable market. Revenue focus, vet cancer, breakthrough liquid biopsy blood test method for early stage cancer detection presented at ESMO 23. So what sets them apart? Our tests are simple, low-cost, accessible, routine blood tests. Platform agnostic, can be adapted to any diagnostic workflow. Manual, reference lab, specialist lab, and point of care. Our intellectual property, 87 patents granted, 136 pending across 48 families worldwide. So when it comes to commercial strategy, their overall strategy, R&D conducted by Volition and its research partners. Volition monetizes IP with upfront payments, milestone payments, royalties, and sales of key components. Commercialization via global partners and in fragmented markets, regional companies. Partner with established diagnostic companies to market, sell, and process their tests, leveraging their networks and expertise, multi-platform, and joint tech transfer. 2 underlying principles: low capex for partners, low opex for Volition, and accessible worldwide. So when it comes to their technologies, cancer and cell death cause chromatin fragmentation. So everyone, I will say this presentation is highly technical. So if you do know a thing or two about biology, cancer research, take a look at this, read it thoroughly, but I'm going to skim over a few things and highlight the key points. A single qPCR assay discovered on leukemia detected 61% of leukemia cases at 98% specificity. Adding a second qPCR detected 74% of leukemia cases at 96% specificity. Another 2 qPCR assay detected 77% of colorectal cancer cases at 92% specificity. Proof of principle for multi-cancer early detection using a 2 qPCR assay, 90% specificity. So here we have some comparisons when it comes to CHIP and PCR with traditional NGS and ctDNA assays. Now let's talk about their Nu.Q product pillars. So how does the Nu.Q test work? So the Nu.Q test is a proprietary epigenetic immunoassay platform that determines levels of circulating nucleosomes in the blood. Nu.Q products, so Nu.Q Vet, Nu.Q Nets, and Nu.Q Discover. So as we can see here, guys, quite a large total addressable market, especially when it comes to the Nets and the Vet. We're talking 33 billion plus. Number of pet dogs in the US, approximately 84 million, nearly 50% of dogs over the age of 10 will develop cancer. That's pretty crazy. That's a very high statistic. So early detection can lead to improved treatment outcomes. Healthy animals can tolerate treatment better. Treatment can be often more cost effective. Early detection also opens up opportunities for therapeutic product development. Why Nu.Q? Screening healthy patients enables early intervention and more proactive discussions around treatment. A simple blood draw, the Nu.Q Vet Cancer Test, doesn't require special equipment. Veterinarians can seamlessly integrate into wellness plans to foster a more holistic approach to pet health. When it comes to clinical evidence, peer-reviewed and published case series of 662 dogs, 134 healthy, 528 with cancer, 7 common cancers were evaluated in this study. So, when to screen? Healthy dogs with a high risk of developing cancer due to age or breed predisposition during routine wellness exams alongside other blood panels at 6-month vaccine booster appointments as an additional data point to track trends. When it comes to their milestones and progress, signed exclusive agreement with Henska providing exclusivity at the point of care, 10 million upfront and 18 million in milestone payments. Point of care expected to launch in the near future, 13 million milestone payment anticipated upon launch of canine screening and monitoring point of care tests. Ongoing revenue for the purchase of kits and key components. Henska, recently acquired by Mars, will join their pet care division. So, milestones and progress. Signed a global supply agreement with IDEXX Laboratories to provide tests through Worldwide Reference Lab Network, launched in the US in Q1 of 2023. IDEXX continues their US lab expansion and is expected to roll out internationally in 2024. In terms of their global growth strategy, reference lab test is available in Italy and France through SkillVet, a Henska subsidiary. We anticipate further expansion into Europe through skill vet upon the launch of point of care. Test is also distributed in Portugal through DNA Tech, the leading diagnostic company in the market, launched in the UK and Ireland November 2023. Additional distribution and or deals expected to be announced in the UK and Asia. Their targets for 2024 are tremendous and very ambitious, including, Australia, parts of Asia, Japan, Europe, and Canada as well. So, development pipeline, monitoring application, cancer in cats, and netosis. Finally, guys, a quick little piece of information. So, NETs, a recent breakthrough in medical science, neutrophil extracellular traps are produced by ejecting chromosomal material out of the cell. Catch and kill bacteria and viruses, can sterilize blood in minutes. Recent studies have pointed to the pivotal role of NET's release in the progression of certain acute, chronic, debilitating, and fatal conditions, sepsis, thrombosis, trauma, metastatic cancer, etc. Sepsis places heavy health, social, and economic burden. Almost 50 million cases, 11 million deaths, 42% of children under 5 years of age. Economic burden of sepsis, 62 billion in the US alone, and expected to increase. So, the current challenge when it comes to sepsis, the rapid identification and treatment of sepsis significantly improves patient outcome and reduces complications for long-term morbidity. The risk of death from sepsis increases by 7.6% for each hour of delay in appropriate antibiotic therapy. Current methods of assessment are both complex and slow. When it comes to their building blocks, platforms and products, market access, regulatory, building clinical evidence, and then in the middle, transitioning from an R&D to a product-oriented organization that will also translate into revenues. The company is already generating revenues. So, in my opinion, in the biotech space, revenue is a good thing. So they're focused right now to develop a low-cost, easy-to-use diagnostic test to stratify risk of sepsis, particularly those at risk of progressing to multiple organ failure, in addition to monitoring the disease progression and response to treatment. So it is time to sum up the story and the key points when it comes to VolitionRx. So, diagnostic company focus on epigenetic markers, breakthrough method of early cancer detection presented at ESMO 2023, human and veterinary cases for screening and monitoring life-altering diseases. We believe our addressable markets are significant, $70+ billion total addressable market. Focus on two key product areas in the short term, 2023 to 2024, and a number of potential stock catalysts. Global supply and licensing agreements signed with leading players. In terms of their third quarter, and we just highlighted this, current cash on hand of $10.8 million, but don't forget they expect to receive those additional payments when it comes to funding. So I hope you guys enjoyed this video. It is a very unique company targeting something very important, cancer diagnostics. As we know, cancer has affected millions and millions of people worldwide. There's many deaths every year from this. So a company that is looking to improve diagnostics, which then improves a patient's odds. Sounds like a good idea to me. So I hope you guys enjoyed this video. Take a look, put this stock on your watch list, and I'll see you guys in our next video. If you like these videos, kindly hit that subscribe button and the bell for notifications. Drop us a comment down below. We'd love to hear from you. And finally, always remember, Departures Capital is for information, education, and entertainment purposes only. Don't buy or sell a stock because you heard it on here. Buy or sell a stock because you've done your research, you've done your thorough due diligence, and you're making your own personal investment decisions for yourself. This video is not financial advice. Furthermore, this video may or may not have been sponsored by the companies that we've profiled within this video, and we may or may not own shares of any of the profiled companies in this video. If you want to know the full disclosure details, check the description down below along with thoroughly reading our disclaimer. Thanks so much for watching, guys, and I look forward to seeing you in our next video.